Hello and welcome. Today, we're diving deep into a condition that can irritate and inflame your eyes, toxic conjunctivitis. We'll explore what causes it, how it affects your eyes, what you can do about it, and how to prevent it in the first place. So, let's get started. Toxic conjunctivitis, at its core, is an inflammatory reaction of the conjunctiva. That's the clear membrane covering the white part of your eye and the inside of your eyelids, caused by direct contact with irritating or toxic substances. Think of it as your eye's way of saying, comment like that. Culprits include medications, like eye drops containing preservatives or certain antibiotics, preservatives found in contact lens solutions, airborne chemicals like smoke or fumes, and even cosmetics. Sometimes, even seemingly harmless products can trigger a reaction in sensitive individuals. Now, let's talk about what happens inside your eye when exposed to these toxins. The irritant directly damages the conjunctival cells, triggering an inflammatory cascade. This cascade involves the release of inflammatory mediators like histamine, prostaglandins, and cytokines. These substances cause vasodilation, meaning the blood vessels in the conjunctiva widen, leading to redness. They also increase vascular permeability, allowing fluid to leak into the surrounding tissues, causing swelling and discharge. The nerve endings are also stimulated, resulting in that characteristic burning, stinging, or itching sensation. Essentially, your eye's immune system is reacting aggressively to what it perceives as a threat. Toxic conjunctivitis doesn't discriminate. It can affect people of all ages and backgrounds. However, certain groups are more susceptible. For example, people who frequently use eye drops, especially those containing preservatives, are at higher risk. Contact lens wearers, particularly those who don't follow proper lens cleaning and disinfecting procedures, are also more prone. Individuals who work in environments with exposure to airborne chemicals or fumes, like construction workers or factory employees, are also at increased risk. Furthermore, people with underlying allergic conditions or sensitive skin may be more likely to develop toxic conjunctivitis. The symptoms of toxic conjunctivitis can range from mild to severe, depending on the offending substance and the individual's sensitivity. Common signs and symptoms include redness of the eye, a gritty or burning sensation, excessive tearing or watery discharge, itching, swelling of the eyelids, blurred vision, and sensitivity to light, also known as photophobia. In severe cases, there may even be small blisters or erosions on the conjunctiva. Importantly, unlike some other types of conjunctivitis, toxic conjunctivitis typically does not involve significant pus-like discharge. Diagnosing toxic conjunctivitis primarily involves a thorough eye examination and a detailed history. Your doctor will ask about your symptoms, any medications you're taking, your contact lens habits, and any potential exposure to irritants. They'll also examine your eyes to look for telltale signs like redness, swelling, and the type of discharge. While there aren't specific lab tests to definitively diagnose toxic conjunctivitis, your doctor may rule out other causes of conjunctivitis, such as bacterial or viral infections, by taking a swab of the discharge for analysis if they suspect something else. While toxic conjunctivitis isn't formally classified into distinct types, it can be categorized based on the causative agent. For example, you might hear terms like medication-induced conjunctivitis or contact lens-related conjunctivitis. The severity of the reaction can also be a way to describe the condition. We can differentiate between mild, moderate, and severe cases based on the intensity of symptoms and the extent of conjunctival involvement. The primary goal of treatment for toxic conjunctivitis is to remove the offending agent. This might involve discontinuing a particular eye drop, switching to a preservative-free contact lens solution, or avoiding exposure to certain chemicals. Artificial tears can help to lubricate the eye and flush out any remaining irritants. In more severe cases, your doctor may prescribe topical corticosteroids to reduce inflammation and promote healing. Cold compresses can also provide relief from swelling and discomfort. It's crucial to follow your doctor's instructions carefully and avoid rubbing your eyes, as this can worsen the irritation. Prevention is key when it comes to toxic conjunctivitis. If you use eye drops frequently, opt for preservative-free formulations whenever possible. Always follow proper contact lens care instructions, including thorough cleaning and disinfecting. Wear protective eyewear when working with chemicals or in environments with airborne irritants. Be mindful of the cosmetics you use around your eyes and avoid sharing makeup with others. And, of course, wash your hands frequently to prevent the spread of any potential irritants. The prognosis for toxic conjunctivitis is generally excellent. With prompt identification and removal of the offending agent, symptoms typically resolve within a few days to a week. However, in rare cases, chronic exposure to irritants can lead to persistent inflammation and scarring of the conjunctiva. Recent research has focused on developing more biocompatible contact lens materials and preservative-free eye drops to minimize the risk of toxic reactions. There's also ongoing research into novel anti-inflammatory agents that could provide more targeted and effective treatment for conjunctivitis in general. And that wraps up our discussion of toxic conjunctivitis. Thank you for watching. Remember, if you experience any eye irritation or discomfort, it's always best to consult with your eye doctor for a proper diagnosis and treatment plan.